Welcome to the Essentia Health podcast series. I'm your host, Yeji Lee. In this series, we bring you helpful information to support your well-being and to overcome the many challenges that life can bring. Our aim is to bring you information or actions to support our well-being that is accessible to everybody. As the days grow shorter and the winter months approach, many of us notice a shift in our mood, energy, and motivation. Some may chalk it up to just winter blues, but for others, these changes can signal a more serious condition known as seasonal affective disorder, or SAD. SAD is a type of depression linked to the reduced sunlight and shorter days of the season, and it can affect anyone, impacting both personal life and work performance. In today's episode, we'll take a closer look at what SAD is, how to recognize the signs in yourself or colleagues, and why it's important to address it early. We'll also share practical strategies you can use to cope with these seasonal changes, from simple daily routines to lifestyle adjustments that can make a real difference. Our guest today is Norman Weiniger, Vice President of Clinical Services here at Essentia Health and licensed mental health practitioner with many years of experience working in the mental health field.
Thank you, Yeji. I'm really happy that we're talking about a timely topic today.
Yeah, thanks for being here, Norman. I want to ask, what exactly is seasonal affective disorder, or SAD, and how can it affect our mood, energy, and maybe our performance at work?
Great question. You've probably heard people, as you mentioned in the introduction, Yeji, talk about winter blues or wintertime blues, but seasonal affective disorder is more than just feeling a little down when the days start getting shorter and there's less and less sunlight. SAD is really a type of a depressive condition that's linked to the reduced sunlight that we have in the wintertime and subsequent changes in our circadian rhythm, which can impact our mood, our energy level, and our motivation. So what does SAD actually look like? Common signs of it include feeling unusually tired or sluggish at this time of year in the winter months. It can include changes in our sleep patterns, and we know that sleep is very important to our overall sense of well-being. That sleep disturbance can be sleeping more than usual or having trouble getting up in the morning, those kinds of things. It can also result in people having cravings for carbohydrates. It can affect changes in weight with people having more stress-related, if you will, eating of high caloric foods in the winter. It can involve increased sense of irritability or difficulty concentrating, and then that general sense of sadness or low mood. Now, you ask about the workplace. In the workplace, SAD can actually impact productivity and focus. Um, People who are experiencing it in the workplace might notice themselves feeling less engaged with their work, maybe struggling to meet deadlines or timelines, experiencing a low level of energy throughout the day, which is detrimental to our productivity. So recognizing signs like that, Yeji, is important, both to your own well-being. You know, we talk about this a lot in our podcast about monitoring our own well-being and being caretakers for our own well-being. And I would be remiss if I didn't mention that anyone who is concerned that they might have a depressive condition of any kind, I would strongly encourage that you speak with your healthcare provider or a mental health professional, or, of course, the employee assistance program.
Norman, so you mentioned there a lot of signs or symptoms that people can look out for. Going off of that, can you talk about what some practical strategies can be that employees can use to manage the effects of SAD?
Yes, I think there's some small daily habits that are achievable that we can build in and work on and celebrate success in that will make a difference. One of them is around light exposure. Can you spend in the wintertime and the dark season, if you will, can you spend time near a window or consider using a light therapy lamp, especially in the morning? That can be very helpful. Movement is another simple but powerful tool, Yeji. So sometimes taking a short walk during the daylight hours, if that's practical, or doing simple um, stretches or movements at your desk or workstation. Things like that can boost your mood and energy and kind of cognitively recharge one. Um, we talked about sleep earlier. Maintaining a consistent sleep schedule is important and something to think about, as well as a balanced diet and being intentional about your diet when it comes to how diet supports our overall well being. And we've spoken about this before, but don't underestimate the power of mindfulness and stress reduction techniques at this time of year. Breathing exercises, meditation apps, journaling. There's a wide range of things in that area that can be helpful. It's another way the EAP can be helpful to people who might want to learn more in that area. So all these strategies are fairly simple and straightforward that can be applied at work or at home. At, at work, again, taking breaks outside, adjusting your workspace lighting if you can, incorporating short movement breaks that can help help you, to maintain your focus and energy. At home, structured routines uh, and are helpful. Staying connected with supportive and understanding family and friends can be beneficial in helping you achieve these goals as well at this time of year. Now, I should say that the EAP provides confidential counseling for anyone who's experiencing symptoms that they think might be related to SAD. The EAP can be helpful when you want to talk to somebody about mood changes or guidance on building some of these coping strategies that I mentioned. And reaching out sooner than later can help the symptoms from significantly impacting one's life, personal life or work life. And the EAP is always a proactive way to take care of issues like this and any others that affect our well-being and our mental health. So I encourage everybody to keep that in mind and keep in mind these simple daily strategies. I think they'll be helpful to you in navigating these darker months with greater resilience and confidence and greater support for your overall well-being, Edgy.
Thanks, Norman. I think with the changing seasons, um, rapid change in weather, the holidays coming up, and it just being a lot of a time of transition and a lot of change for many people, it can be overwhelming, and so I think it's important that we bring light to um, taking care of yourself, self care during this time, and just being more conscientious about like you mentioned, your well-being and mental health. So just want to reiterate, if you want to learn more about SAD or maybe experiencing symptoms of it, you can always reach out to your EAP for more information or help. And with that, we conclude today's podcast. On behalf of everyone here at Essentra Health, thank you for listening.